Press power button, the indicator light turns to green, it will get into the ready interface. Press up button to choose gender. Female. Male. Pediatrics mode. Pediatrics mode only suitable for the urine volume less than 100 ml. 2 cm from the pubic bone. Place enough gel onto it. Disinfection the probe. Place probe on the gel, smile face toward to patient's head and make it 10 to 30 degrees lean to the head. Press scan button to enter the pre-scan mode. Bladder image displaying. Move the probe up and down and adjust the lean degree slowly. Maximize the dark space of bladder volume. Move the probe left and right slowly. While the dark space is in the middle of the sector, press the probe moderate until the image clearly. Keep the probe steady. Press scan button again to enter into the scan interface. Testing result. Press print button and print the testing result. Press power button to power off and clean the probe. After scanning, press up button to check the first 4 images. Press up again to check second 4 images. Press up again to check the last 4 images. If the red envelope line is the 12 images, it overlaps with the bladder edge completely, then the testing is effective. If the red envelope line was obviously smaller or bigger or deviated from the bladder edge, then this testing result was ineffective and needed to rescan. The reasons of ineffective testing result. The gel is not enough, the bladder edge is not clear. Place the probe in a wrong position, parts of the bladder is out of the scan range. The probe has been moved and shaked, or the pressure of the probe is not enough when is scanning. The patient coughed and the abdomen moved. Press up button when in the testing result interface. Confirm the effectiveness of all the images. Press left button. Enter into the ID edit interface to input patient's ID. By pressing left, right, up and down buttons to choose the needed letters. The letter will changes to white when you move the cursor to it, press OK button to choose it. If there's any wrong input, press OK button to delete the last input letter, and then press Save button to save. System will automatically back to ready interface to have next testing. Press left button when in the ready interface. By press up and down to check the previous testing results. Press print button to print the reports. Press right button to back to ready interface. Obese patient. Reduce the probe lean degree to patient's head or lean the probe to patient's feet. Bladder deviation patient, put the probe above the pubic bone and move it to find the best position. Bladder fibrosis patient, bladder diverticulum patient, put the probe 2 cm above the pubic bone, and then deviate it 1 cm to the right side. Choose the largest dark space but not the largest bladder border. Prostate enlargement patient, put the probe 3 to 4 cm above the pubic bone and avoid the prostate. Post-void residual volume, put the probe 2 cm above left of the pubic bone. Bladder contraction with difficult, before testing, need to massage or hot compress the bladder for several minutes. Bladder volume more than 500 milliliters, the probe needs to put 3 to 4 centimeters above the pubic bone.